Thank you so much. So this is the final presentation of this session, and I'm delighted to introduce you to Helen and Abhi, who is the SAPC winning presentation in education. It's a long title, so they can say it. Welcome.
Hi SAPC, hi ASME. I'd love to say that we look young enough to be students. Unfortunately, we're not. We're GPs. But I'm Abhi Jones, and this is my colleague Helen Miles, and we're here to talk about our community-based MDT simulation and its impact on interprofessional competencies in undergraduate students. So we're all facing the same problem of dealing with the complex healthcare needs of an aging population, and we know that those are best managed with integrated health and social care teams. Interprofessional education can help those teams develop the skills they need for effective collaborative practice. However, good IPE can be difficult to produce due to the challenges of things like geographical spacing, timetables, and they can be very resource intensive. So to try and overcome these challenges, we had to be creative, and the pandemic forced us to kind of rethink our default mode of delivery of face-to-face. And so we created an online community-based IPE simulation, which we've focused on using a case study of the common scenario of a paramedic call out to a lady with frailty after a fall. 526 undergraduates took part across 9 professional groups, including district nursing, through to social work and speech and language therapy. We used Microsoft Teams as our base platform, and the event had a morning and afternoon session. The students came preloaded to the session using pre-work from a podcast as well as other simulated, supporting information. The morning session focused on scaffolding the students with the skills that they would need for the afternoon MDT simulation. And then the students met within the Teams channels within groups of about 10 students to discuss through the case material and work through it, assess it, and then work through a comprehensive geriatric assessment to document it. The session then finished with a group debrief using the diamond model. We used a lot of different types of technology, and this short video just shows one of the ones that we used, which was ThingLink. ThingLink allows you to have an image that can be explored, and we used a 360-degree image, which we embedded our case material within. The hotspots allowed students to select various items and click and access things like medication lists, GP records, social work notes.
So we had a pre and post event questionnaire, and we got 149 responses to our pre-event questionnaire and 183 to our post-event questionnaire. But we'd done some pilot work on our study before this, and we'd originally used the interprofessional socialisation and valuing scale. But we found that this just had too many items on it, so we had 21, and they seemed to be quite similar to us. So we looked at the interprofessional education and collaborative care core competencies, which you can see down the left-hand side here. So we've got values and ethics, roles and responsibilities, interprofessional communication, team and team working. And we also added our own, which was developed in collaboration with our multidisciplinary research group. And this was around formulating a person-centred multidisciplinary management plan for an individual with frailty. And we reduced those items down to 12, which we grouped around these core competencies. And we looked at Cronbach's alpha for this on both of our questionnaires, and the results would be above 0.9 for both. We then looked at significance using the t-test, an independent t-test. Oops, let's move on. And you can see our pre-event results, which are in the middle here, and our post-event results on the right here. I realise there's a lot of data here, so I think, you know, we're looking at green is good when you're looking at this. All of these show significant improvement in the post-event, apart from number 5 here, which is patient involvement in decision-making, which actually we had quite a pre-event mean, which I would expect for our students. And also number 7 here, which you can see just at the top, which was around patient involvement in decision-making, which I was glad students felt confident about that in before the event with a high mean. We also asked them 3 text questions. So we asked students what they wanted to achieve from the event in the pre-event questionnaire. And in the post-event questionnaire, we asked students to reflect using questions based around roles reflective framework. So what, why, what next? We used inductive thematic analysis to come up with our themes, but then what we used later was the lens of the core competencies that we looked at originally to kind of review the themes that we got. So we've got some pre-event themes here, which were for our core competencies around communication. And interestingly enough, communication didn't really come up in the pre-event questionnaire. And then we've got some post-event themes where actually when students reflected, we found that they did come up with communication. It was much more nuanced. And we've got a nice quote there, communication between professionals is imperative. In this theme, which is around the roles and perspectives of others, in the pre-event, so this is around learning within, understanding the roles within the MDT, and in the pre-event, we've got that there was, the students expected to learn about this and that they did. And in fact, this is our absolute favourite quote from the whole thing. So we've got occupational therapists and social workers. How cool are they? That was from one of our medical students on the event. We then got another theme here, which was around MDT and teamwork. And understandably, students, the themes were that that's what they wanted to achieve. And they did. But afterwards, we found this was much more nuanced. So actually, they talked a lot about the different skills within the team, and they talked a lot about responsibility within the team as well. So teamwork makes the dream work. You cannot do it all on your own. I think we had some quite creative students answering our questionnaire. And this is our last competency. So this is around this patient-centred MDT approach to frailty. And in the pre-event themes, we looked at students very concentrating really just on knowledge about frailty. And what we were really pleased about is actually in the post-event, in the reflection, it wasn't just the knowledge, it was the holistic care, it was the patient-centred care that they discussed.
And finishing off with our last quote. So how professionals work together holistically support the needs of an individual. So the implications of this research has shown that large-scale online non-acute simulation has a positive effect on IPEC competencies and help address the challenges of scale and resource. And we know that the teams of method is easily replicable for large numbers, and we can use this in chronic disease, community-based scenarios, and consider it in postgraduate learning. The questionnaire is we're also hoping to now use in our other IPE simulations and sessions to see whether there is difference in outcome for the IPEC competencies. From a limitations perspective, the before and after responses of the students weren't paired. And because we used a questionnaire, we weren't able to explore in more depth those qualitative responses. Also, the responses are based on the students' opinions, and so we can't guarantee that that necessarily translates into their practice. And we're unclear whether the improvement in competencies will actually lead to improved collaboration and patient care. Thank you for listening, and we'll leave you with our favourite quote and for any questions. Thank you.